I'm going to touch a little bit on the sexual health questions. So does taking Viagra really help restore erections after your prostate is removed, or is a drug company trying to sell more Viagra? Well, in a lot of people, okay, in most people who fall under that definition of having erectile dysfunction, the pills will cut the mustard. But it really depends on, especially for prostate surgery, what was your function before surgery? What is your age at the time of surgery? Those are the big predictors of what your function will be after surgery. So if you're going into your prostate surgery and you have great erectile function, you don't need anything, then it's possible that those pills are going to work great for you afterwards. But if you're going into surgery and you're having to use the maximum dose of Viagra or Cialis or injection therapy, those things will likely not do the trick after surgery. The other thing too, when we talk about penile rehabilitation, there are no great studies that say penile rehab, whether it's with injections or Cialis, Levitra, Viagra after surgery, will get you back to what your function was before surgery. It just depends on how aggressive you want to be. And if you want to try it kind of when you're okay to start having sexual intercourse, take a daily Cialis or take it on demand to try to get some blood flow into the penis. What we do know is that the longer you wait after not getting a good erection for a long period of time, the tissue changes. Same thing, the tissue in my face, whatever. When you don't get good blood flow, the tissue scars down. So what Dr. Erickson and I see in the office are guys who say, well, you know, I don't understand. Like I had radiation or I had prostate surgery or I had diabetes and doc, I haven't had a good erection in like 5 years. And then let's say we do an injection or we put a penile implant in and that guy looks down and he's like, what? Like I'm bigger than that. Doc, I swear I am bigger than what I am right now in the office. And the reality is we believe you. We believe that you were bigger, but we can't get you back to what you were when you were 19 years old. And so for the people who want to be as aggressive as possible, like Dr. Erickson and I will be right there with you to restore your function on your timeline. There is a correlation between erectile dysfunction, heart and prostate medications. Those were included in that list, the beta blockers, the water pills, those commonly can worsen erectile function. Prostate medications can cause sexual dysfunction. If you're on an alpha blocker, for example, like Flomax, that you take to help relax the muscle in your prostate, that can cause retrograde ejaculation. So where the ejaculate goes back into your bladder when you orgasm and then you pee it out, not dangerous, but for some people, it can be quite bothersome. The other medications that shrink the prostate, like finasteride, for example, can have sexual side effects in some men. We spoke about the comparison of Viagra versus Cialis and some of those side effects. For an everyday medication to treat ED, that's going to be where Cialis really fits into this algorithm. What treatment options are there for a buried penis? So what a terrible word. I mean, I'm sorry. It's like technically a diagnosis. I think it's a little bit silly, but hey, it's kind of some of the terms that we use. So what happens is, and I'll kind of use some of these examples here, is the erectile tissue stays connected to the pubic bone. And when men are overweight, what happens is oftentimes they accumulate fat in this suprapubic tissue right here. And so because this is a fixed structure, this area kind of grows over the penis kind of goes in. If it's a moist environment, for example, that tissue can then grow over the penis and literally bury the penis. You can also see this example here, where the erectile bodies are connected to the pubic bone here, and then you get this accumulation of fat. So what we'll oftentimes do is a buried penis repair. We will remove the excess tissue. We might even put a skin graft around the shaft of the penis. And then once you heal from that, we can talk about options to put something like a penile implant in or treat you with any of the other therapies we would for sexual health. Testosterone.
I'll jump in here. I think that is a very difficult question about the buried penis and erectile dysfunction. I think a lot of men don't realize that half of their erectile tissue is on the inside of their body, and all you're seeing is just the outside, maybe half, sometimes less than half. I also know that a lot of men that have had prostate surgery and they come to see us 5 years, 6 years, 10 years after surgery, their body's changed. The blood flow has changed to the penis. And as you mentioned, it can decrease the size of the shaft, but it also, in that 5 to 10 years, they've also gained some weight sometimes. And that can make, the combination can make it seem like there's nothing left. We, on occasion, it's not common, but we'll often do a buried penis repair first, sometimes simultaneously, but buried penis repair first, deliver the penis, make sure that there is enough so that if you were going to have or attempt intercourse with an erect penis, that it would be functional and usable. So it's complicated, but again, something that we deal with here at the university quite a bit.
Awesome. Yeah.
Right.
And then the last thing that I'll address is testosterone. Testosterone is really important. It is very difficult to get a good erection if your testosterone is low. Testosterone levels go down with age for a variety of different reasons. One is from age, and other is just a lot of environmental factors, a lot of which we don't even know about. I see a lot of men in their 30s and 40s actually who are coming in with low sex drive, and they have fatigue during the day, a drop in erectile function, like all these things. What they're really saying to me is, Doc, I'm 40 years old. My body is changing. I want to live my best life, but Doc, I am struggling. And erectile dysfunction kind of falls in as one of those symptoms. But a lot of those things can be due to low testosterone. It's not a game changer for everybody, but it's just one of the things that we can treat. So testosterone, if it's low, we don't necessarily put someone on testosterone as a treatment for erectile dysfunction. But let's say you were taking Viagra and it was working for you 5 years ago. And you say, Dr. Erickson, the Viagra is no longer doing the trick. What is up? Let's say Dr. Erickson checks your testosterone and it's low. Then he puts you on testosterone therapy. You might then respond better to something like Viagra. So we use it with the medications for erectile dysfunction. Sometimes we use it alone. It does play a role in our practice, and it is certainly something that we in the men's health program at the University of Iowa can tackle with you and for you.